Hi there. Today's practice is to try to help with pain. And I'm going to start by saying that although there are many categories, many different styles of practices for dealing with chronic pain, we can probably put them into two main categories. One is a direct technique where you're purposefully bringing your attention right into the pain, like you're trying to face it head on, like you're staring down the tiger. And the other style is an indirect technique, where you're trying to use more of a distraction, trying to pull the nervous system's attention away from the pain. And if you're someone who lives in chronic pain, you're very well aware of the fact that it demands a lot of your attention. So on some days, you'll find that it's actually better for your system to do those distraction techniques where you're pulling the focus to somewhere or something else. In reality, we need a combination of both. So we need to do a little bit of bringing our attention right into the pain, and we need to do a little bit of distraction technique. When to choose which is something that only you are going to be able to know for yourself, and part of knowing when and what to use is building your body awareness. So the more of these breath, mindfulness, awareness practices, bodiness practices that you do, the better in touch you'll be with your own system, and it'll become easier and easier to know what you need when. You'll start to get to that place when on any given day you'll say, okay, I know that when I'm feeling like this type of technique or this type of practice is what helps me most. In the meantime, if you're not there yet, I would say that it's safer is a strong word, but I can't think of a better word right now. It's safer to use a distraction technique if you're unsure. If you're having one of those days where you didn't sleep well that night and you can barely think of what your name is because the pain is so challenging, that's probably not the day where you need to face it head on. Today's practice is going to be more of a distraction style, so I'm going to ask you to get into a comfortable position. And I recommend not seated for this one unless that is your favorite position. Take the time to get into what is most comfortable. Use as many props and supports as you need. If you feel like you want to cozy up under a blanket, then this is the time to do that. So pause the video, set yourself up. I'm going to assume that you're set up now. So close the eyes and take a moment just to get present here where you are and here in your body. Whatever position you've chosen, allow the support to hold you, to give you a sense of safety, so that you're able to let go a little bit and just drop in. And then bring your attention to your breath without trying to change it, without labeling it, just notice it. Notice the sound, the rhythm, and the feel of it. And you might find that as soon as you bring your attention to your breath, it starts to change. That's quite common. And if that happens, just notice what the changes are. But don't try to purposefully influence it. And then I'm going to ask you to bring your attention to somewhere in the body that's just neutral. So it's not an area of discomfort, nor is it an area that feels fantastic. It's just an area that you don't even notice during your day, so you might have to search for it. For those of you who are living with the type of chronic pain that's body-wide, it can be challenging because you feel like you have pain everywhere, but search around and see, is there some small part of you that today is just neutral? And it could be the tip of your nose or your eyelids or your scalp. Search in the places that you don't normally think of and see if you can find a place that's just neutral for you. Once you've chosen that spot, you're going to just bring all of your awareness and attention to that one spot and mentally outline it. So literally like you're tracing the outline of that spot, no matter how big or small it is. And then here everyone's different what they respond to, so you can think of either bringing breath into that spot or that area. You can bring liquid in any form that speaks to you. You can bring color. You can bring light or energy. See what resonates with you. You can try experimenting with a couple of different ones and see which ones kind of land in your system. And you're going to fill that whole area with whatever you've chosen. Breath, liquid, light, color, energy. And as you continue to send whatever you've chosen into that area, and as you continue to just focus on the sound, the rhythm, and the feel of your breath, start to visualize that area you've chosen getting larger. So it's like it starts to seep past the outline that you circled around it. And here you might want to pause the video so that you can take as much time as you need for you to allow that area to bleed into a larger and larger and larger area. And as you start to be able to visualize that area getting larger, start to bring your awareness to the parts of the body that it starts to encompass, that it starts to envelope. So for an example, maybe if the spot you chose at the beginning was just the tip of your elbow, and as you're meditating on that spot and you're bringing light or liquid or breath, whatever you've chosen, into that area, now it starts to cover part of the upper arm and part of your forearm. And name those parts of the body that it starts to cover. And notice that there are larger areas, or maybe more numbers of areas of the body that are neutral today. Stay with that and keep using whatever you've chosen, or experiment with the other options to continue trying to expand that area so that it takes over a little bit more space in your body. And if that's not happening for you yet today, that's fine. If that original spot that you've chosen and the outline you made around it is staying the same size and the same shape, that's perfectly fine. It might take several attempts at this practice before you're able to see it grow. But still do the same practice of bringing all of your awareness, all of your attention and intention into that one neutral zone, and send breath, color, light, energy, or liquid, whatever works, into that area. Keep your focus on that for another 3 to 4 breaths. Keep trying to visualize it getting larger. Keep trying to visualize it seeping out past the borders you originally created so that it takes over a little bit more of your body parts. And then slowly just bring your attention back to the breath so that you're a little bit more centered, not so much focused on the one area that we've been working on today. You can hear the geese behind me, supporting you in this practice today. And as you come back to that rhythm and sound and feel of your breath, just notice any changes. Maybe you can compare the intensity or the nature of the pain you're feeling now compared to what you were feeling at the beginning of the practice. And it's not necessarily that the pain is going to have gone away. For some of you it might, and that's wonderful. But for most of you, it's just that something about it may have changed. Maybe took the edge off a little bit. Maybe the intensity came down a level or 2 or 3 or 4. Or maybe now it's just a different type of pain, and any of those are positive. Stay with this for 2 more breaths. And gently open the eyes into a soft gaze first, And then slowly bring your attention back into the room. And if you were lying down, just take your time to slowly move fingers and toes, ankles and wrists, and build that into whatever organic stretch of the body feels like it makes sense for you. And take that with you into the rest of your day.